As parents, we cherish every milestone our children achieve. From their first steps to their first words, each moment is a testament to their growth. However, delays in reaching these milestones can be concerning. Speech delay is a common developmental issue. It refers to difficulty in developing spoken language. It includes understanding and expressing language. Addressing speech delay promptly supports communication development. Remember, speech delay is not a reflection of intelligence, it means they need extra support to catch up. Understanding the underlying causes of speech delay is paramount in providing effective intervention strategies. While the exact reasons can vary from child to child, several common factors contribute to speech and language delays. One prominent cause is hearing impairment. If a child has difficulty hearing, it can significantly impact their ability to learn and process language. Other medical conditions, such as autism spectrum disorder, cerebral palsy, and childhood apraxia of speech, can also contribute to speech delays. Genetic factors can also play a role, as children with a family history of speech or language delays may be more susceptible. Environmental factors such as limited exposure to language and social interaction can also hinder speech development. Identifying the specific cause or combination of causes is essential in tailoring interventions to meet the child's unique needs. Early identification and intervention are crucial for children with speech delay. Recognizing the signs early on allows parents and caregivers to seek professional help and provide the necessary support. While developmental milestones can vary slightly, there are general age-appropriate guidelines to consider. By 12 months of age, most children start babbling and using gestures to communicate. By 18 months, they typically have a vocabulary of about 20 words. At 2 years old, children usually start putting 2 words together to form simple sentences. If a child is not meeting these milestones or shows other signs of speech delay, such as difficulty understanding simple instructions, frustration in communicating, or avoiding eye contact, it is crucial to consult with a pediatrician or a speech-language pathologist. Section 4. Empowering solutions. Helping your child find their voice. Discovering that your child has a speech delay can be overwhelming. But remember that there are numerous ways to support their communication development. Early intervention is key, and there are various methods and therapies available to help children improve their speech and language skills. Speech-language therapy is one of the most effective interventions for speech delay. Speech-language pathologists, or SLPs, are trained professionals who specialize in assessing and treating communication disorders. They work closely with children to develop individualized treatment plans that address their specific needs. In addition to therapy, parents can play a vital role in supporting their child's language development at home. Creating a language-rich environment is crucial. This can involve talking to your child frequently, reading books together, and singing songs. Encourage your child to communicate by giving them your full attention when they try to speak, even if their words are not yet clear. Section 5. Expert insights, guidance from professionals in the field. Early identification and intervention are paramount, says Dr. Laura Smith, a certified speech-language pathologist. The earlier we start, the better the outcomes. Parents are their child's first teachers, and their involvement is invaluable. Dr. Smith emphasizes creating a supportive environment. Focus on strengths and celebrate progress, she adds. Positive reinforcement and patience build confidence. Real-world success stories show the power of early intervention. Section 6. A hopeful journey. Supporting your child's communication development. Navigating the journey of speech delay can be challenging, but it is essential to remember that there is hope. With early intervention, dedicated support from parents and professionals, and a positive and encouraging environment, children with speech delay can make significant strides in their communication development. Remember that every child learns and grows at their own pace. Focus on celebrating your child's achievements, no matter how small they may seem. Patience, persistence, and unwavering love will empower your child to find their voice and reach their full potential. If you have concerns about your child's speech development, don't hesitate to reach out to your pediatrician or a qualified speech-language pathologist.